Welcome everyone to Resilience Brilliance, where we talk about resilience and experts who share their tips and tricks with all of us. And today I have a very exciting guest. Her name is Hélène Bertrand, British Columbia in Canada. And she is a 1965 med school graduate. And she loves life and she loves what she does and she wants people to be happy. And she's 82 and she still skis Whistler, which I think is fantastic as a skier myself. And she loves puzzles and any unsolved problems, which is really important. And that's the connector to what she's doing still at her age. And in her practice, doctors would refer patients to her that they could not solve their pain problems. And 80% of those patients left without pain. So today's topic is going to be managing our pain. And I am very excited to introduce Helene to all of us. So welcome. Thank you for being here today, Helene.
Well, thank you for inviting me, Jenna. I'm very glad to be here because I want everybody to know how to relieve their own pain. Well, essentially, if you want to know my background, when I was a kid, my father used to send me to my room when he punished me. And that was no punishment at all. I had all my books and I could read my books. And when he realized that, I was 10 years old. My dad was a brain surgeon and my room was his library. So he took all my books and put them down in the basement. And then he'd send me up to my room, and all I had were his medical books and his neurosurgical books. And so I learned I would be sent to my room. I'd start reading Grey's Anatomy, and I'd start reading all his neurology and neurosurgery journals. And by the time I got to medical school, when I was 17, I knew a hell of a lot.
That's a really young age to go to medical school. Did you graduate fast?
Yeah, I had my BA when I was 17.
Excellent.
And that was my first 2 years of medical school was at Université de Montréal, which is a French-speaking university. And then when I was 19, I got married to my first husband. And he was going to be studying in Boston. He was doing a residency in Boston. And so I applied to Harvard. And I did Université de Montréal is a 5-year course. So I did my second year again because Harvard is a 4-year course. I did my second year again at Harvard and I loved it. It was because at Université de Montréal, if I asked a question, people would go, oh my God, there she goes again. Whereas at Harvard, if I asked a question, they would come after the class and they'd say, that was a good question. I wonder how we would solve that. And that's how I've been thinking all my life. And so I felt like the ugly duckling and the duck with the swans. So I was having a wonderful time at Harvard. And then my husband said, oh, he didn't like Boston. And so I had to leave Harvard and I went back to Montreal with him, but I couldn't go back to Université de Montréal because it's a 5-year course. So I finished at McGill. So I went to 3 medical schools. But the only one I really loved was Harvard because McGill was just like Université de Montréal. Oh my God, there she goes again. So it's a different attitude. Like they don't want to know more, they know. And as far as I'm concerned, that's not how you solve problems. How you solve problems is you have to look at what's behind, what's causing this. And if you look at what's behind, you can discover all kinds of ways to solve problems. And that's what I did in my medical career. I started working with breastfeeding mothers when I was doing breastfeeding problems, breastfeeding my own kids. And I invented new ways to treat breast infections and new ways to operate on abscesses. And I started teaching about breastfeeding. And then I got my first husband didn't like Quebecers because they spoke French. So we went to British Columbia in Canada, and I started working there. The only place that would accept me was alcohol and drug programs. So I started working at alcohol and drugs, and I invented new ways to treat the need to smoke and to do drugs. And what I was doing was I was inventing Parkinson's disease is a dopamine deficiency disease. And dopamine is your pleasure transmitter. And that's what you need when you're doing drugs or smoking or drinking. And so I thought, why don't we put them on medications for dopamine deficiency, for Parkinson's disease? And I did that, and it worked better than anything else. And then I decided to divorce my first husband, and I started working in North Vancouver, where I still am. And I found that there were a lot of people who had severe chronic pain. And for me, that was something that I knew a lot about, because at the end of my first pregnancy, I started getting really bad low back pain. And I had years of really bad low back pain. And I had so much pain that at times I couldn't even roll over in bed or get up out of bed or walk or go up or downstairs. And I had to keep working all this time. And in spite of the fact that my back was killing me. And I don't believe in medications because I know I'm a doctor. I know all their side effects. So I tried to avoid medications. So what I did was I went to chiropractors, I went to physiotherapists, I did all kinds of exercises, Pilates exercises and strengthening of all kinds of exercises. I did physiotherapy, obviously. I did massage therapy, all kinds of treatments. Nothing was giving me good relief. And eventually, a friend of mine, I was sitting down at the talk, and as I sat down, my back killed me. And I said, my sacroiliac joints are killing me. And he said, that's okay. He said, come to my place, I'll do prolotherapy on you. I said, Prolo, what? And
I've never
heard of that. Well, what it is, essentially, is you see, what holds your joints together are called ligaments. And if you look at a chicken leg or something, you'll see this white stuff around the joints. Well, that's your ligaments that are holding the joint together. And when your joint goes out of place, it's because those ligaments are not holding. And so you need to strengthen those ligaments. But the problem is those ligaments are white. They don't have any blood supply. And if you cut yourself, you'll notice that where you cut yourself, it gets all red around the wound. The reason it gets all red is that there are blood vessels there, and you're growing new blood vessels that are going to go towards the wound and bring the repair cells where you're broken. And those repair cells will deposit collagen, scar tissue, to hold the break together. Well, if you don't have blood vessels, there's no way you can fix yourself. And so the way you can fix yourself is where those ligaments attach on the covering of the bone. That covering is loaded with blood vessels. Why is it loaded with blood vessels? Because all your blood cells are being made in your bone marrow. And so they have to go get those blood cells. So those ligaments are sucking up the blood cells that are being made in the bone marrow. They're putting it in blood vessels that then go to the rest of your body. Well, those ligaments that attach on those blood vessels, if you create a little injury where the ligaments attach on the blood vessels, that injury will grow new blood vessels in the ligaments. And the new blood vessels bring in the repair cells. And the repair cells are collagen. They're depositing collagen. And collagen is what ligaments are made of. And so you strengthen your ligaments with prolotherapy. So I started doing that to my patients, and they were all getting better, and it was wonderful, and I was so happy. But I had to charge for that. And because it takes time and you have to know what you're doing. And sometimes you have to use ultrasound to find out exactly where the ligament's attaching and so on. So I was doing it, but there are some people that couldn't afford it. And I wanted to give them relief. And so I reviewed my anatomy. And guess what? We're vertical animals, right? We're vertical.
Yep.
We're not on all fours. We put all our weight, the weight of our head, our shoulders, our arms, our liver, our kidneys, everything we eat, the fat we have on our body. And it's all going down, not on your spine. Where is it going down?
Your feet.
It's going down, I'll show you, right here on your pelvic bones. They're the bones that carry the whole weight of your upper body, the whole weight. And it's pushing the pelvic bones away from the sacrum where they attach. Here, see where my fingers are going? Can you see how my fingers are going up?
Yep.
Yep,
I see it.
I see it. Well, you see, my fingers are level because my pelvic bones are level. You see, that's the top of my pelvic bone. It goes here, 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 all the way here, all the way here, and all the way to this little thing in the front, okay? That's the top of the pelvic bones. So if the fingers are level and there's no pain underneath, you know that there's no problem. If the fingers are not level, there is a problem because the pelvic bone is too far forward if the finger is higher up, or too far backwards if the finger's lower down. You know, it is just makes sense. And once you know that, then you can fix 90% of all low back pain because that's the main cause of low back pain. Now, why is it that doctors don't know that? Well,
Yeah.
why?
Why?
Well, it's because our hip joints, you can feel your hip joints, they're right here, okay? Our hip joints are inside our pelvic bones. Every time our foot hits the ground, that jolts our pelvic bones. That jolts the joint between the sacrum and the pelvic bones where they attach, okay? That joint, it's called the sacroiliac joint. That joint is your body's main shock absorber. It's absorbing the shock every time your foot hits the ground. And because of that, instead of being smooth like every other joint in your body, it's full of bumps and hollows to absorb the shock of every step you take. That makes that joint invisible to x-rays, CT scans, MRIs, or ultrasounds. You cannot see the level of that joint.
I had no idea.
And you know that pain, which essentially the International Pain Society calls non-specific. That means we don't know because they can't tell which joint is higher or lower. I just showed you how to tell which one is out of place and in what direction it's out of place. Once you know that, you don't need non-specific treatments. You know exactly what you need to do. And that's the treatment that I've invented, and it works amazingly well. So, and because of that, I wrote a book about it. Low back pain, 3 steps to relief in 2 minutes. Because
everybody should be ordering that book. 2 minutes.
2 minutes. That's all it takes. All you need to do is hold that position for 2 minutes. Because it takes about 2 minutes to move those bones. If you hold a position for 2 minutes, when you get up, you've got a 90% chance of being pain-free. So, because you've put the joint back where it belongs. It's that simple. And I want the whole world to know about that. So that's why I created that. Well, there's actually several exercises you can do that, but all you need to do, essentially, the principle is that if the joint is too far forward, you've got to push it back. And if it's too far backwards, you got to pull it forward. If it's too far forward, you push it back with your thigh. And if it's too far backwards, you stretch your thigh way back to pull it forward. It's that simple. Hold it for 2 minutes and you're putting the joint back where it belongs. I know, and it's so crazy. And they were presenting this case at the Canadian Pain Society meeting. And I was a member of the Canadian Pain Society, so I was at that meeting. And this woman had 20 years of low back pain, and nothing was working. And at the end of the talk, because I've done this research project and I've proven that it works, at the end of the talk, I put up my hand and I said, did anybody check the level of her pelvic bones? There was silence. And I said, well, if you know in what direction the bones are displaced, then the treatment is obvious, takes 2 minutes, and has a 90% success rate. They immediately shut me out of the Zoom, immediately. And then the next day they sent me an email that I had to sign saying I would never mention this again. And so I signed it because I didn't want to be left out of these pain meetings. And then in September, they were presenting a talk on narcotics and how to use them and when and how and so on. And I hate narcotics. I know what they do to people. So in the chat, I didn't put up my hand, but in the chat, I put, there is a new treatment for low back pain. Interested, ? And I put my email. And immediately shut me out. And the next day, the Dr. John Pereira, the president of the Canadian Pain Society, emailed me and said that I was never to attend any of their meetings in person or on Zoom. And
Terrible.
so essentially, the Canadian Pain Society has doctors, surgeons, chiropractors, massage therapists, physiotherapists, acupuncturists, all the people who deal with pain. And I was excluded. And that is why I wrote my book. Because I thought, okay, you guys don't want to hear about it. I'm going to tell the whole world.
Yeah, go direct.
And that's why I'm talking to you.
I'm glad that you are, because there are so many people who do live with chronic pain.
Well, the thing is that doctors, in the last 12 years of my 55-year practice, in the last 12 years, doctors would send me their hopeless pain cases. And 80% of them left my practice with no pain. And one of the things I invented was injecting around nerves with this mannitol substance, which every plant and every mushroom has, because it's an antioxidant and also it kills germs. So every living thing has mannitol. But I was injecting it around nerves, and even before the needle was out of the skin, the pain was gone. And so I had a lot of doctors and pharmacists come and look at what I was doing because I had good results. And this pharmacist came to see me, and she said, I've never seen pain go away so fast and so completely, but people don't like needles. Why don't we make it into a cream? I said, sure, let's make it into a cream.
And is that you want to show a tube?
Yeah, well, we had to try 16 different base creams before we found one that allowed the mannitol to penetrate through the skin and to reach the nerves. Because what mannitol does is it shuts down the pain message and the itch message that nerves send to the brain. So it has to reach the nerves. So if your pain is like a heart attack, it's not going to reach that area. It's too deep. So it's superficial pain, like migraine headaches or burning feet or burning fingers or arthritis of the fingers or of the knees or pain in the feet or where the nerves are close to the skin or pain in the neck or that sort of thing is where the cream will work best. And this is what the cream looks like. It's called QR cream. And essentially, I called it QR because it's quick relief and it's QR.
Clever. And now you're selling this on Amazon now.
Yes, you can get it on Amazon. By the way, I tested it on 235 of my patients with 289 different pain conditions, because some people had migraine headaches and arthritis of their hands or whatever. In exchange for a little sample of the cream, which they could bring home, they had to fill out a questionnaire. The date, the time, how bad your pain is from 0 to 10, how bad it was after 30 minutes of putting on the cream, and how long it lasted and how long it took for you to get some relief. And so I've got that database on these 289 different pain conditions. And the average pain relief is 53%. Okay, it's not 100%, but the average pain relief for narcotics is 36%. The average pain relief for anti-inflammatories like Voltaren or Advil or aspirin is 26%. And the average pain relief for Tylenol is 13%. So 53% is pretty damn good.
It is. Now, why don't you tell me a little bit about when you flew to India to replicate your research project on low pain?
Oh yeah, the thing is that I was doing this research project on low back pain, and this group from Kochi, India wanted to replicate my research. And that's precious, because if you do research and it's replicated, then it shows that it's a fact. And so I flew to Kochi, India, and I get to the airport, and the customs officer says, "And why are you here?" And I said, "Well, I'm here to organize a low back pain research project." "That's a business, and you've got a tourist visa." I said, no, I'm not making money out of this. This is research. He said, "I'm calling my superior." So in comes the chief customs officer. "It's a business." "No, in 2 minutes I can remove low back pain." 2 minutes? "Yes." "Wait here." So he comes back 5 minutes later with this woman, female customs officer, dressed in a sari. You know how I was feeling my back the other? Well, can you imagine feeling through all the folds of a sari? I said, there's 100 people in this room. I can't treat her here. And he said, "Well, there's a little table over there." And so the three of us, we walked to the little table. I examined her through her sari. Thank goodness she wasn't all that overweight. And sure enough, her pelvic bones are out of place. So I give her the 2-minute exercise, which she does. And then she gets up, she tests her back, and then she says, "It's a miracle."
And they let you in?
Oh my gosh, the chief customs officer said, "Welcome to India." And he prolonged my visa.
That's fantastic.
But the problem was, it was the 20th of 2020, and the airport was going to be closed in another week. So I had a week with those doctors to teach them how to do it. And when I left, one of the doctors said, "Dr. Bertrand, we've never seen so many low back pain patients leave our office with a big smile on their face."
That's a fantastic story. And the timing was just incredible to be able
Yeah,
to go and do that before the shutdowns of all the airports.
yeah, but that was just too bloody close.
Yeah.
And unfortunately, at my old age, I just don't want to go back to India again, which is unfortunate.
Yeah. Tell me about the woman who had psoriasis that you gave the cream to?
Well, you see, doctors would send me their chronic, hopeless pain cases. And this woman was sent to me because she had terribly sore shoulders. So I'm expecting to examine her shoulders. But when she was coming in, she had no hair on her head. All she had was psoriasis. And she came in like this. And I said, "Well, I can fix your shoulders, but if you're scratching all the time, you're hurting your shoulders all the time." And she said, "I can't stop, doctor. I've had this for 15 years. She said, "My daughters can see where I've been in the house by the trail of skin flakes I leave behind." And I said, "Well, why don't you try my cream?" She says, "It's not going to work." I said, "What do you mean it's not going to work? You haven't tried it." She said, "I've tried everything. In the last 15 years, I've tried everything. Nothing works. And I said, well, try my cream. It's not costing you anything. Just try it. So she puts it on, and 3 minutes later, her itch is gone. and and when she came back, a month later, when she came back, she had this much hair on her head and no psoriasis. Her name is Patricia. And if you look at qrcream.com, click on the testimonials, look for Patricia, and you'll see her.
I'll definitely go and check it out.
So it's so much fun. But I wanted, you see, that's unfortunate because I'm so old, I'm no longer practicing medicine, so I can't do the research. I've actually got permission from the University of British Columbia to do this randomized controlled trial on psoriasis, itchy psoriasis. But unfortunately, I can't do the research anymore because I'm not practicing anymore. So, and I'm pretty sure, like people have huge numbers of pharmaceuticals for psoriasis, and the pills and the creams they've invented are all exceedingly expensive, and because they're very developed, but I can't do that anymore. But I would suggest that people who have really bad itchy psoriasis try QR cream, because if it worked for this lady, it should work. And by the way, when my grandchildren had mosquito bites, before they could even speak, if I saw them scratching mosquito bites, I would just put the cream on the mosquito bite and they immediately stopped scratching. I mean, it takes away itch.
Well, that's fantastic.
I've had loads and loads of adventures with this cream. And that, by the way, is a hell of a lot cheaper than anything you'd get a pharmacist to make for you. It's not as cheap as the other creams that you can get on the market. Yes. It's much more effective, and the mannitol is expensive. The mannitol that I'm using, unfortunately, forces me to keep the price of the cream higher than I would like to have it because it's expensive. So,
well, that's because it's so good, right?
I know it's very good. And for instance, I had a woman email me a couple of weeks ago that she had terrible burning feet, and she was on gabapentin, and she tried pregabalin, she tried all the other anti-neuropathy pain stuff, and nothing was working. And I said, well, why don't you get some QR cream and put it where your feet are burning? And she said, well, I have trouble reaching my feet because she's 86. And so I said, well, why don't you put it on a sponge on a stick and just rub it on your feet? And she did that, and her burning went away. And she is just so thrilled that her peripheral neuropathy, her burning, has disappeared.
That's amazing.
And
It's so refreshing to hear these stories, when people are living with chronic pain or they have discomfort, or in the gallop with the itching psoriasis on her head, to be a solution provider and relief for somebody. I mean, how does that make you feel to be able to provide this relief and help people restore their vitality?
well, for me, I get such a kick out of helping people. Like, for me, that's why I'm alive. That's why I want the whole world to know how to relieve their own pain. I had 37 years of horrible pain, and I don't want anybody to be faced with that. I want the whole world to know how to relieve their pain. And it's quite possible. It's not that difficult. When I'm doing my walk down, I'm going up and down pretty steep hills, and I see people limping, and I'll ask them where they have pain. Well, if they have pain in their foot or their knee, I'll find pieces of wood, pieces of grass, stuff that I can find on the ground, that I can change the orientation of their foot, take the pressure off the joints, and take away their pain right then and there on the trail. And it's so much fun.
Well, and I'm sure they're wowed on the trail. And then when I know we talked earlier, and you do carry your business cards with your QR codes with you on your hikes. So I think that's a great way to spread the word. And I know that there are many people who want to hear this and buy this. So why don't you go ahead and tell them what free resource you have available?
Well, my free resource is the low back pain. Essentially, the first chapter of my low back pain book, which people, or the preface actually, where people can read about this, and if they're interested, then they can get the book. And all they have to do is just sign up. They go to my website. By the way, there's an easy way to get to my website. You go to nopain.ca. So essentially, you go to no-pain.ca or no-pain.ca.
Yep.
And if you go there, then you can be offered that preface of the book, which is
Excellent.
And the other thing is that this is the qrcream.com. And in qrcream.com, there's all kinds of things ideas that you can do to help yourself.
Yeah, and when we first met, you gave me the instructions on how to realign my sacroiliac joints because I was like far apart. I felt an immediate relief. And what she's talking about is real. I haven't tried the cream, but I'm going to get some, that's for sure. And we're going to take a quick moment just to talk about Resilience Brilliance, and then we're going to get back to Helene. But every month I offer a free live training course on resilience. It's resiliencebrilliance.co. Will be in the show notes. Hop on over there. Again, it's once a month, a free live training session on resilience. And I have my sign too. So I'll show everybody. Here's what it looks like. Before we finish here today, what other important things do you want to talk about with people while we have them listening?
Well, I think that there are many, many ways that you can deal with pain. And just these exercises or the cream are some ways, but you also need good sleep, and you need a good diet, and you need exercise. And these are things that people nowadays don't do properly. Like, I'm 82, and I'm walking up and down steep hills about 4 miles every single day. I also I live on vegetables and berries and fish and eggs and things that are very, very good for you. And the other thing is good relationships. If you have somebody that you can count on, somebody that you love, that is terribly important. So good sleep, good exercise, good diet, good relationships are terribly important, particularly if you have an issue with pain. And I'm going to be giving a course on how people can deal with their low back pain. And we're going to talk about, yes, how to correct the pain, but also how to deal with all the other issues that make it easy for your pain to be controlled.
When is that?
I don't know yet because I'm just preparing the course now. But it's going to be on SI joint pain or sacroiliac joint pain, which is the cause of 90% of all low back pain. And so I think it's terribly important. And thank you ever so much, Jenna. It was lovely speaking with you.
Thank you so much for being here today. I really appreciate you taking the time out of your busy day to talk to us about pain management, and not just pain management, but pain relief. Thank you so much, all of you. Stay tuned and listen to this episode. Until next time, be real, be resilient, reclaim your life. Ciao.